side. Arch goes from right to the left. That is why you will start from right side. The right subclavian artery starts from brachiocephalic trunk. The left one starts directly from the arch of aorta. Then topography. You will explain topography of this artery, how it goes. This artery goes in arc-shaped manner. Surrounds the cupula of the pleura. Yes, on both sides, surrounds the cupula of the pleura and leaves the thoracic cavity. Where it passes, it enters in interscalene space. Where it lies on the first rib, special groove. Sulcus arteria subclavia costa prima. First rib has groove for this artery. It lies directly in groove on this rib, and above the artery you can see the trunks of the brachial plexus. These brachial plexus trunks together with artery lie in interscalene space. After leaving of this interscalene, between scalenus anterior, scalenus medius muscles, we have this space, fatty tissue space, where lies artery and artery. In this space, it lies on first rib. After leaving of this space, it surrounds the external margin of the first rib and directly continues in the axillary cavity, and here it calls arteria axillaris. Direct continuation is called arteria axillaris. Thus, arteries of the upper limb, you will start from subclavian artery. And three parts of subclavian artery and branches of each part. First part, before interscalene space. Second, after. And then you will explain the arteries of upper limb. And parallel to this, you will explain arteries of the lower extremity. What artery goes to the lower extremity? Like here, subclavian goes to the lower limb. What artery goes from the pelvic cavity? What is this? Bifurcation, yes, aortic. Divides into two common iliac. Common iliac on the level of the sacroiliac joint is divided into the external iliac, internal. External iliac gives only two parietal branches. This and this. Arteria circumflexa iliace profunda and epigastrica inferior artery. To the walls of the pelvic cavity, to the iliacus muscle, circumflexa iliace profunda, and to the rectus sheath below. From below goes on posterior wall of the rectus muscle. When this artery reaches the inguinal ligament, about midpoint of this ligament, under the ligament, what two lacuna we have? Lacuna musculorum, lacuna vasorum. Artery passes through lacuna vasorum, together with vena, arteria vena femoralis. Vena lies more medially. And from here, just from inguinal ligament and lacuna vasorum, it is called continuation. Arteria femoralis. Thus, to the lower extremity, what artery goes? Iliaca externa from pelvic cavity, which continues with femoralis. To the upper limb goes arteria subclavia, which continues with axillaris. Thus, on thigh we have one bone, on brachial region one bone. That is why one main artery we have in brachium and in femur, the thigh region. Arteria femoralis, arteria brachialis. And they give the similar branches. For example, before this axillaris will explain, and arteria iliaca externa gives these two branches, but arteria axillaris branches divided into three portions, in accordance with three triangles of axillary cavity. Anterior wall has three triangles. Anterior wall of axillary cavity. Here we can describe. This is pectoralis major, minor, yes? Between clavicle and pectoralis minor. Clavipectoral triangle. Here gives two branches. This to the pectoralis muscle branches, thoracic superior, and thoracoacromial artery to the deltoid, to the acromion, clavicle, thoracoacromial and thoracic superior. On pectoral triangle, it gives thoracic lateralis to the serratus anterior muscle. in subpectoral triangle below this muscle, this subpectoral here, subpectoral triangle, it gives subscapularis artery and two arteries which surround the humerus. Arteria circumflexa humeri anterior, arteria circumflexa humeri posterior. Subscapularis in turn is divided thoracodorsal artery and circumflexa scapula, which through foramen trilaterum goes to the dorsal surface of the scapula, arteria circumflexa scapula. Where the axillaris starts? From external margin of first rib. Where axillaris ended? On the lower margin of what muscle? This muscle or this muscle? What muscle is this? Pectoralis major, in front. Behind what muscle? Is latissimus dorsi, this white muscle. In front, this the same level. Crista tuberculi majoris, crista tuberculi minoris attached. About here, arteria axillaris ended. Starts from first rib until low margin of this muscle. 3 triangles. Continues with what artery? With arteria brachialis. Where passes brachialis? On medial side of biceps. On both sides of biceps we have grooves. Sulcus bicipitalis lateralis, sulcus bicipitalis medialis. On medialis lie the majority of structure, vessels, nerves lie on medial groove, sulcus bicipitalis medialis. And arteria together with nerves. The brachial plexus nerves surround axillary artery from all sides, lateral, medial, posterior. Vein, axillary vein accompanies this great artery, and together with axillary lymph nodes, they lie in axillary cavity. This cavity with fatty tissue space, very difficult space. There, he has so many arterial and venous branches, nerves, lymph nodes. Can you imagine how it's difficult to clean the lymph nodes when, in case of cancer of mammary gland? Surgery, open this axillary cavity and remove, with removing so great cut they have on anterior wall, remove all mammary gland and clean here all lymph nodes from the vessels and nerves between them, clean. So many groups. Do you remember lymph nodes of axillary cavity? Medial, lateral, anterior, posterior, central and apical. So many lymph nodes, all they must clean among nerves, vessels, arteries, and ligated some arteries, very difficult region. And then brachial artery goes on sulcus bicipitalis medialis. Here it gives arteria profunda brachii, profunda, deep brachial artery, which has spiral way. It don't go so, it goes spirally from medial side to lateral side, but not superficially it goes. It lies where? What canal here we have? Between triceps and humerus. Revise please topography of the limbs. Muscular topography, upper limb and lower limb. All canals. Humeromuscular canal. Between humerus and triceps we have canalis humeromuscularis. And this artery passes between triceps and humerus, together with nervus radialis. It's from this side and then appears from this side. Inside the canal supplies triceps, humerus, and gives collateralis media to the joint. Below of profunda brachii, from brachialis arise two arteries. Side arteries on side of this what bone lies from medial side. What two bones? Radius, ulna. That is why there's on the side of ulna arise. Collateral, it means side artery. Collateralis ulnaris superior, collateralis ulnaris inferior. About mid-half of brachial arises, mid-half of the humerus arises collateralis ulnaris superior, which goes behind epicondylus medialis. Collateralis ulnaris inferior goes in front of epicondylus, and they supply the elbow joint. That's what main branches arise from brachialis, profunda brachii, Collateralis ulnaris superior and collateralis ulnaris inferior. And this artery in cubital fossa gives two end branches. What end branches? Radialis and ulnaris. It is divided in two end arteries. Arteria radialis, which is direct continuation, and arteria ulnaris. But on the brachium, it gives, what artery is this? Between muscle and humerus. Profunda brachia. Prices as collateralis radialis inside gives collateralis media to the triceps muscle and humerus. Do you understand? In your notebook, this write the branches: axillaris, branches; brachialis, branches. Now radialis ulnaris, and the same will be on the thigh. Parallel. We'll describe on the thigh what main artery. Here brachialis, here femoralis. What main branch will give femoralis? Like here profunda brachii, here will be profunda femoris. It is the main artery. In the case of obliteration artery, where the lumen is closed, or atherosclerosis or emboli, thromboembolism of the artery, but below of profunda brachii, on this distance. Through this profunda brachii can be supplied. The blood flows through this side vessel, through the anastomosis. The same main collateral side vessel is arteria profunda femoris, for femoralis. This artery mainly supplied the muscles of the thigh, no femoralis. It gives two circumflex arteries, circumflexa femoris lateralis, circumflexa femoris medialis, ascending, transverse, descending branches gives three perforantes arteries, arteria perforantes, prima, secunda, terza, to the posterior group of the muscle. But femoralis also gives muscular branches, but before this it gives to the external genitalia arteria pudenta externa, two free arteria pudenta externa gives arteria pudenta externa to the external genitalia. Before this, it is the principal artery, where it lies 3-4 centimeters before of inguinal ligament. If you pull up femoral artery from the posterior part, goes this short arteria profunda femoris, which immediately divided into circumflexa femoris lateralis, medialis, perforantes. But before this, it gives small branches to the genitalia, pudenta externa, circumflexa iliaca superficialis, and epigastrica superficialis, which goes to anterior abdominal wall. And then this artery, which at first passes in femoral triangle, trigonum femoralis carpi, in between iliacus pectineus muscle, sulcus iliopectineus, sulcus femoralis, it passes in adductor canal. Do you remember this adductor canal? Together with vena femoralis, nervus saphenous, passes superficially in this canal. Through the anterior foramen of this canal gives last branch, descendens genicularis artery to the knee joint, and then continues in posterior surface. Why the femoral artery has this interesting course? No, it goes don't go so directly. Because what regularity do you remember? The arteries pass on what surface? Only flexor surface of the extremities, not on dorsal surface. Because of the only on flexor. Flexor surface for hip joint is what? Anterior. Flexor for the knee, posterior. That is why artery from this flexor goes to this posterior. That is why this regularity of arteries explains why arteries from anterior goes to the posterior surface. This course it has. If the arteries pass on extensor surface during flexion, it can be stretched. That is why it goes only more convenient, more protective surface is flexor, together with veins, together with nerves, in well protected grooves and canals, all regularity. And where we have, in accordance with structure of skeleton, yes? With one bone we have one artery, two bones, two arteries, many bones radial, many arteries we have on the hand and on the foot. And in the side of the joints they form arterial networks. Here we reach, what part we reach? Forearm. And here, grooves. We will compare. Now we just before I have explained brachial region and femoral region, and now we'll compare antebrachial with the region of the grooves. Here we have two bones, radius ulna. Here we have tibia fibula. That's why tibialis artery, fibularis artery. Here radialis artery, ulnaris artery. Arteria radialis and ulnaris, they are branches of what artery? Brachialis. End branches. By the way, brachialis gives three branches. Yes, on the brachium it gives three branches. This profunda brachii, collateralis ulnaris superior and inferior. But two end branches. Where it ended? In cubital fossa, on the level of column radii. It is divided two end branches. Artery here ended. Continuous radialis ulnaris. Now, both arteries give the similar branches, recurrent branches to the joint. This will be recurrent radialis. This will be recurrent ulnaris. This elbow joint, what three main arteries supply? Brachialis, radialis, and ulnaris. Three arteries, but there are many branches which form 8 arteries, arterial network composing from 8 arteries. Do you remember this picture? Blackboard during lecture. Have you this picture? Because you are a professor and don't present during lecture. This on lecture. Yeah. If you have red color pen or pencil, it is more better. Так. Brachialis artery, да? What branch it gives? Profunda brachii, which goes spirally. It's hidden under the muscle, that is why, and then appears as collateralis radialis. Inside canal, it gives collateralis media artery. Then brachialis goes and divided into arteria radialis, and what artery else? Arteria ulnaris, which gives interossa. They must be similar by lumen, and which is divided into two interossa anterior, posterior artery. About mid-half of this arteria, brachialis, this main, brachialis. This is arteria profunda brachii. About mid-half goes arteria collateralis ulnaris superior. Below goes arteria collateralis ulnaris inferior. And profunda brachii, when it appears from the lateral side. Yeah? That is why this artery is called arteria collateralis radialis, from the side of arteria collateralis radialis. There are collateralis ulnaris, this collateralis radialis. And inside the canal, it gives arteria collateralis media. This arteria radialis. This arteria ulnaris. This arteria interossa communis, common interossa. Between two bones, ulnaris gives common interossal artery. Interossa communis. This radialis, what branch gives? Recurrent branch. Arteria recurrens radialis. Ulnaris, what branch gives? Recurrent. Arteria recurrens ulnaris. which is divided into the anterior and posterior branches to ramus anterior, ramus posterior. Arteria recurrens ulnaris, ramus anterior et ramus posterior. Thus we have how many arteries from brachialis? How many arteries? 1, 2, 3, 4. This recurrens radialis 5. This interossea communis gives recurrent interosseal artery. Arteria interossea recurrens. Radialis and ulnaris gives. It is better to draw this artery. The main is radialis. This main. All other is net. Arteria interossea recurrens. Спасибо. 5, 6, 7, 8. Thus, arteria brachialis, radialis, and ulnaris form this network. Brachialis, what branch gives? Profunda brachii, collateralis radialis, media. And collateralis ulnaris superior, inferior. Radialis gives recurrent radialis, ulnaris gives recurrent ulnaris with anterior, posterior, and interossea communis gives interossea recurrent. They all give recurrent. By the way, brachialis gives, radialis ulnaris pass below, but return and give to the neighbor in accordance with low short distance. To the neighboring joint, they send branches to this joint. They lie near the joint. That is why they send branch to the joint. By the way, send branches. All these three arteries, recurrent. Sorry. And then continue. Then radialis ulnaris, what branches will give? Muscular. Muscular to the radial group of muscle, flexor. Do you remember? Brachioradialis, flexor carpi radialis, flexor zygitorum. So this flexor carpi ulnaris and ulna head of the flexor zygitorum profundus. Interossea and arteria ulnaris gives common interosseal artery, interossea communis, which is divided interossea anterior, until carpal region, rete participate, and interossea posterior, which gives arteria interossea recurrens, recurrent branch. And also participate in dorsal rete carpale dorsale. This anterior also goes to the dorsal surface and participate in rete carpale dorsale. In lower part, what region is this region? Carpal, yes? Both arteries will send branches to the carpus. What surface is palmar, dorsal, rami, palma, these branches, ramus carpalis palmaris arteria ulnaris and ramus carpalis palmaris arteria radialis. Here will be ramus carpalis dorsalis ulnaris, ramus carpalis dorsalis radialis. Both arteries give carpal branches, palmaris radialis, palmaris ulnaris, dorsalis radialis, dorsalis, and they form rete carpale, carpal network, rete carpale. Palmare, where is rete carpale, and rete carpale dorsale. Here rete carpale dorsale and palmare, it is not marked. Rete carpale palmare. Do you understand? At first they give recurrent branch, they give muscular branch, they give carpal, same. Only ulnaris gives interossal, it is only branch of ulnaris. And then reach the hand region, Yeah. Ulnaris continues in arc-shaped manner. The end part of ulnaris continues under the aponeurosis palmaris, on mid-half of the hand, continues and form anastomose with ramus palmaris superficialis from arteria radialis. They form arcus palmaris superficialis, superficial palmar arch, arcus palmaris superficialis. Arteria radialis, in distinction from this ulnaris, it don't go directly to the palmar surface. It goes to the dorsal surface when it reaches the brachioradialis tendon, under the brachioradialis tendon, it turns to the dorsal surface. What is this? Do you remember? Anatomical snuff box. Artery passes in this anatomical snuff box. Arteria radialis appears here. It goes in sulcus radialis, this artery, in sulcus ulnaris passes. Low part of the forearm is called topographically sulcus radialis, sulcus ulnaris, and sulcus medianus. Sulcus radialis, where the artery lies, covered by superficial fascia. That is why you can touch here pulse of this artery. More easy touch pulse of the radialis here, but not ulnaris. Ulnaris is hidden under, between the muscles, more deeply located. That is why more easy touch the pulse of the arteria radialis and sulcus radialis for therapy. So it is covered only by superficial fascia. And from here it turns to the dorsal surface of the hand, where it passes in anatomical snuff box, and here it gives to the dorsal branch, to the first, to the pollex, arteria metacarpalis dorsalis prima, dorsal surface. And when it turns through the first interosseal muscle on the palmar surface, it goes so, then penetrates this muscle and appears here. It gives proper branches to the pollex. Arteria princeps pollicis. Arteria princeps pollicis. Arteria princeps pollicis. This artery gives branches of arteria princeps and radialis index to the radial side of index. This finger is pollex, index, digitus medius, annularis minimus. This index, this pollex. Princeps pollex, the proper artery. Pollex, so compound movements, yes, performs. That is why this finger receives special proper arteries. Metacarpalis dorsalis prima, princeps pollicis artery. And the same artery gives radialis, send branches to the radial side of the index. That is why I turn your attention that from the superficial palmar arch arise 3 common digital arteries, which are divided into the 6 proper digital. Because from the ulnaris arise artery to the medial side of digitus minimus, to the pollex and radial side of index, arteries arise from radialis. This from ulnaris, not from arch. These arteries arise from radialis. That is why from arcus palmaris superficialis, how many arteries arise? 1, 2, 3. They are called arteria, this tendon, arteria digitalis communis, common, arteria digitalis palmaris communis, 3 in number, which are divided in 6 arteria digitalis palmaris propria, common digital, proper digital. The superficial arch, once more, is formed by end part of arteria ulnaris, which anastamoses with superficial palmar branch of radialis. The principal arteria radialis goes to the dorsal surface through anatomical snuff box. Here supplies dorsal surface of first finger, and after penetration of muscle supplies both sides of the pollex and palmar surface, princeps pollicis and radialis indicis. And by superficial branch it forms junction with ulnaris. And how is ended the radialis? The radialis sends to the pollex, the princeps pollicis, and goes in arc-shaped manner, ended under the tendon of the muscles, flexor muscles, directly lies on the bones, on the metacarpal bones, and form anastomose with deep palmar branch from arteria ulnaris. Ramus palmaris profundus arteria ulnaris forms arcus palmaris profundus, deep palmar arch. Arcus palmaris profundus. This is deep palmar arch. By what artery is formed? Mainly by radialis, which form junction with deep branch of ulnaris. Superficial arch vice versa, by ulnaris end part and superficial branch from radialis. Deep is formed by radialis.